Hello, fellow animal aficionados. Welcome back to Vetcast, the podcast where we dive into the wild world of veterinary medicine. I'm your host, Dr. Catherine Wilkinson, and today we're tackling some fascinating findings from the realm of veterinary ophthalmology, ocular oddities, and systemic shenanigans, a vet eye-opener. And yes, before we get started, I want to be upfront. I have used a bit of AI wizardry here, and so you can hear the slightly corny script. But let's face it, we're all busy. I'm busy. I just need to be able to get into some of these papers to find out more about what I want to read in more detail. So it's just a springboard, a way of getting a quick overview of the research out there. Always do your own deep dive when you find something that really sparks your interest, and double check, because even AI gets it wrong sometimes. First up, let's talk about something that we do practically every day, the Schirmer tear test, or STT1. You know, that little paper strip that we stick in a patient's eye. Well, apparently we might be doing it wrong, or at least inconsistently. A recent study published in Veterinary Ophthalmology looked at how eyelid status, open or closed, affects Schirmer tear test results in dogs, specifically brachycephalic and non-brachycephalic breeds. Now, you'd think it wouldn't make much of a difference, right? Just a quick little strip, a minute or so, and Bob's your uncle. But no. Oren Peer and his team found that Schirmer tear test values were significantly higher when the eyelids of the dogs were closed. And this was the case in both Shih Tzus and Labrador Retrievers. In labs, the difference could be as much as 13 millimetres a minute. That's a huge swing. In Shih Tzus, it was up to 7 millimetres a minute. 7 millimetres per minute. So, what does this mean for us in practice? Well, for starters, consistency is key. If you're measuring tear production over time, you need to stick to either open or closed eyelids. And let's be honest, a lot of us are just winging it. The survey in the study found that a whopping 34.6% of vets never paid attention to eyelid status. I think I might have been in that category myself. The researchers suggest that the higher values with closed eyelids are likely due to sustained reflex tearing. Think about it. When the eyelids are closed, the strip is in constant contact with the cornea, stimulating tear production. Open eyelids? Well, dogs blink, they look around, the strip might move a bit. You get the idea. Now, there was a bit of concern about corneal abrasion with closed eyelids, but the study didn't find significant issues. But it's something to keep in mind, especially with those squishy-faced brachycephalics. So, bottom line, pick a method and stick to it, and maybe let the rest of your team know too. And remember, this study was done in healthy dogs, so tear film instability or other ocular issues might throw a spanner in the works. Okay, moving on to the next paper. This time, we're talking about anterior uveitis and its prevalence in dogs and cats with systemic inflammatory response syndrome, or SIRS. Mark Fortuny-Clanchett and his team at Valencia decided to see just how common uveitis is in a patient with SIRS. And guess what? It's pretty darn common. They looked at 42 patients with SIRS and 26 without. And here's the kicker. 38% of the SIRS group developed anterior uveitis, compared to only 7.7% in the controlled group. Now that's a significant difference. Now, we all know that SIRS is a nasty business. It's the body's way of saying something is seriously wrong. And it turns out the eyes are often caught in the crossfire. The study found that uveitis was significantly more prevalent in these patients. So what does this mean for your clinical practice? Well, for starters, a complete ophthalmic exam should be on the cards for any patient with SIRS. aqueous flare, low intraocular pressure, miosis, episcleral injection. These are all signs to look out for. And let's be honest, in the hustle and bustle of emergency care, it's easy to overlook the eyes. But this study highlights just how important it is. SIRS can be caused by all sorts of things: sepsis, pancreatitis, trauma, and all of them can lead to ocular inflammation. The take-home message here is simple: don't forget the eyes, as if any veterinary ophthalmologist would. A quick slit lamp exam can make a huge difference in patient management. So, to sum up, we've learned that consistent technique is crucial for Shermattitis, and that a thorough ophthalmic exam is vital in patients with SIRS. Remember, these are only quick summaries to help you explore the research. I encourage you to dive deeper into these studies and see how they can improve your clinical practice. And so that's all we have time for today on Vetcast. Remember to subscribe, leave a review, and tell your colleagues. Until next time, stay curious, stay compassionate, and keep those tails wagging.